Have you ever been interested in having braces but was a little bit skeptical? Well, today I am here to inform you about braces and how they change people's lives every single day. First, I'm going to start out with a little bit of insight and history on braces. Braces were first designed in 1728. They consisted of a flat piece of metal that went all the way across the teeth, and how they were attached to the teeth was by a small piece of thread. I know, sounds a little bit illogical when it comes to having braces put on and also wearing them. But fortunately, orthodontists have been able to make great strides throughout the years and have made the braces experience a whole lot better. Everyone has their own opinions about braces, but it is a great choice for people who would like to achieve the perfect, pretty smile. Braces are what is used when aligning the teeth. Alignment starts with brackets and wires placed on the teeth. With time, the teeth begin to shift and move, and the teeth come together and they become straight. There are two different types of braces. There are metal braces and there are ceramic braces. Metal braces, of course, are made of all metal, and ceramic braces consist of ceramic brackets but metal wire. Many people would much rather have ceramic braces because they're a little less noticeable. But what most people don't know is that they're quite a bit more expensive, and they are also going to cause you to be in braces a little bit longer than metal ones. There are two types of different habits that people have that can cause them to be in braces a lot longer than somebody who didn't have these habits. One habit is finger or thumb sucking, and the other habit is patients as babies having the availability to a pacifier for an extended amount of time. Both of these can cause a rather extensive overbite, and that is when the four front six top teeth protrude out further than the bottom ones. It can cause a major gap when biting down in between the upper arch and the lower arch, and sometimes the overbite can be so extensive that the only way to fix it is through surgery. Now, sometimes the overbite isn't that extensive. It's able to be fixed with a few teeth on top being pulled out, and when those spaces where those teeth were are closed, it brings the upper teeth back. Now, there are many people who think, oh, I would love to have braces, but I don't want to deal with the pain. But what needs to be realized is that all people are different. Some say that braces hurt so much that they were so extremely sore they can't even take the pain. That within days of having the braces put on, they go back and have the braces taken off. But then there are some people, which are most, who say braces really aren't that bad. Braces can be a challenging journey for some, depending on his or her treatment plan. And what that is when the patient and the orthodontist come together and make a plan as to what needs to be done to achieve what the patient desires. But what counts most is for the patient and the orthodontist to, of course, meet the same result, which is straight teeth. We now know braces are the alignment of the teeth using brackets and wires, but there are many different aspects to braces, from how they fix the teeth to the experience for both the orthodontist and the patient. Everyone's experience is different, but most will say they benefit. Believe it or not, almost everyone needs braces, but not everyone really wants them. Actually, very few want them. Braces aren't for everyone, but they do have the ability to change a person's life by making them more confident. And when somebody has the confidence, they can take on the world. And to most orthodontists, that is what makes their job and their career choice all worthwhile.